Hello everyone. Our project is called Relation between Lung Cancer Incident and Smoking of Practical Mathematical Model, presented by Hongdan Yang and Wenwen He. We are both from the EECE department. We have the following parts to share about it. First, the abstract and the objectives, the introduction and background, the solution and technique details, the timeline, and finally the future and conclusion. First, let's come to the abstract. Recent years, lung cancer had been one of the leading causes of cancer-related death. There had been more and more evidences showing that factors such as smoking, gender, diet, and obesity might be positively associated with cancer risk. Then the objective of our project. The main purpose of this paper is to investigate the relevant influencing factors of lung cancer patients and build a probability model to provide a reference for clinical active intervention. Methods of Bayesian, Bernoulli distribution, and exponential distribution are used. As for the part 3, we will focus on the introduction and background of our project. Lung cancer is the most common primary lung malignant tumor. Most of the lung cancer originated from bronchial mucosa epithelium, so also known as bronchial lung cancer. In the past 50 years, the incidence and mortality of lung cancer have risen rapidly in all countries in the world, especially in some industrialized countries. Lung cancer has been the world's leading cause of cancer deaths now, with 600,000 deaths worldwide in 1995, and the number still rising every year. According to the recent research, gender and smoking become significant effect factors on lung cancer incidence. China has more than 315 million smokers, with a male to female ratio of 6 to 1 or more in all ages groups, according to data from CNTC from 2018. Meanwhile, lung cancer has ranked first among men who die of cancer. Apparently, there is a violent relationship between smoking, gender, and lung cancer incidence. Thus, we decide to focus on some of these indexes and analyze the relationship among them using Bayesian network. The background of these three algorithms. For Bayesian network, it is also known as LeapNet or causal networks. It is a graphical formalism for representing joint probability distribution. Bayesian networks provide a convenient and coherent way to present uncertainty in uncertain models. And for binomial distribution, it is frequently used to model the number of success in a sample of size n joined with replacement from a population of size big N. For all cases of n much larger than small n, the binomial distribution has a good approximation and is widely used. For exponential distribution, it is a probability distribution of the time between events in a point process, and that is a process in which events occur continuously and independently at a constant average rate. Then the part 4 is the most significant part, solution and technique details. 3. Stochastic process is binomial distribution, Gaussian distribution, and Bayesian network. Individually speaking, the random variables for binomial distribution is that let random variable x be the number of patients get lung cancer in a group of n-dependent smokers. For Gaussian distribution, let random variable y be the number of patients get lung cancer in a given region. And for Bayesian network, different indexes used in the joint probability analysis: gender, age, treatment management, and drug resistance. These have been mentioned in the previous slides, so we just move on. For all the details of the algorithms, we had learned them in the lectures, so we just put the formulas here and as a reference. We quickly move on. The outcomes of our project can be divided into 3 parts for 3 individual algorithms. First, for binomial distribution. In this project, the probability of getting lung cancer among different smoker populations can be intuitively obtained by using binomial distribution. By observing the histogram, it can be concluded that the probability of lung cancer increases with the increasing of smoking years. As for the Poisson distribution, in this project, it can be used to analyze the probability of disease in a certain region to accurately predict the possibility of disease in the future. For Bayesian network, it is a model demonstrates that age, drug resistance, and treatment style are the main factors directly affecting the treatment outcome of elderly patients. This model can be used to identify the relevant influencing factors and the intensity of the causal effect on the treatment outcome of elderly patients with lung cancer, which can be used to identify the target population and high-risk population for control and management. Then I will just introduce the technique details for binomial distribution, and my team member Wen Wenhe will introduce the others. For binomial distribution, we have mentioned the basis formula, and it's just shown here. For smokers, the average risk to get lung cancer is referred as P, which just lists the probabilities of average risk to get lung cancer for different years, just shown as the table here. In this table, the year means the years of smoking and the P means the probability of being attacked by lung cancer. We use Excel to plot the histogram to show the data visually and clearly. Then assume that there are 100 smokers. The average probability of being attracted by lung cancer for them is 0.16 by using MATLAB. The figure of PDF is shown as here. Then Wen Wenhe will introduce the details of Poisson distribution and Bayesian network.